Welcome everyone to our 18th CRWDP webinar. I'll just give you a brief description of how the presentation is going to run today. I'll first introduce our speaker, then we'll move on to the presentation, and followed by that we'll have a Q&A. So to introduce our really amazing speaker, we have Duygu today with us. She is a PhD candidate at St. Mary's University and a senior research associate at the Canadian Centre for Advanced Leadership at the Haskayne School of Business. Duygu's research interests lie at the intersection of leadership and healthy work, and more specifically, she studies how employees with chronic pain can and can't work and the role of leadership in this process. For her CRWDP project, Duygu investigates how leadership can influence chronic pain and work disability due to chronic pain. So I'll turn it over to you now, Duygu.
So thank you then for the introduction, and thanks for giving me the opportunity to share my research with you all. So as Dan already mentioned, my topic is on leadership, chronic pain, and chronic pain disability. But before I start, I just want to make a disclaimer. So I have attended a number of webinars in this series, and what I've seen is that in those webinars, researchers usually answered similar questions using very different approaches. So I thought just explaining where I'm coming from can be helpful. So I am a PhD candidate in industrial and organizational psychology. And that's why I study leadership and healthy and safe work in general. And today's topic is at the intersection of both two. Because I'm a psychologist, I'm mostly interested in the individual more than the system. And I focus on understanding individuals' emotions, thoughts, behaviors, mostly in their social environment. And I like using the term me-search to describe my research on chronic pain. I have been suffering from chronic neck and lower back pain for about 16 years now. And it has impacted my life and work to a significant degree. And now as a researcher, I think I have the tools, skills, and the luxury of understanding it from a scientific point of view for my work. So today's presentation will actually be an overview of 3 studies. This is a part of a larger research program. I've been working on chronic pain for about 5 years now. So we first started understanding the work experiences of employees with chronic pain. And then we spent some time, I mean my colleagues and I spent some time understanding the workplace factors that might have a role in chronic pain and chronic pain disability. And then we identified key players in this process. And recently, we turned our focus more on the prevention side of chronic pain and chronic pain disability. And today's presentation will be mostly on the prevention part, but I will provide a very high-level overview of other research that we did in this program as well. So let's start with the basics. What is chronic pain? So chronic pain is defined as pain that persists for at least 3 months. So this can be a continuous pain or recurring pain. But what makes it chronic is that it should be there for more than 3 months. And chronic pain is a source of disability. So it is a disabling sensation, and it can turn into a disability under certain conditions. And in the literature, it is characterized as an invisible type of disability. That means we cannot tell if a person is in pain or not. And we can't tell to what degree they have been experiencing pain unless they decide to share it with us, either through communicate with us through facial expressions or verbally or bodily. And also chronic pain disability is characterized as a type of episodic disability, meaning, unlike the permanent types of disability with chronic pain, people can be fully functional in some days, fully dysfunctional some other days, and semi-functional in some days. And the pain fluctuates over time, so does the disability. And what makes it particularly challenging for employees is that it is hard to predict when employees will experience a pain episode. Therefore, they cannot prepare for it. And although chronic pain can be defined as a disease in itself, usually there are underlying health conditions. So in many cases, in most of the cases, chronic pain is accompanied by another health condition, such as arthritis, or it goes hand in hand with mental health problems. So when I do this presentation in other settings, I notice that people usually come to those seminars with pre-existing assumptions about chronic pain. So some people think of an employee who got injured at work, therefore they have chronic pain. Some others have a prototypical person of a prototype of a person with chronic health conditions in their minds. But actually, chronic pain cases cover all of these prototypes. So it can have biological roots. So genetical tendencies or medical conditions can cause chronic pain, but also lifestyle factors such as sleep, exercise, nutrition can help with the development of chronic pain. And also work conditions such as repetitive, doing the same movement for an extended period of time, or sitting or standing for long hours at work, or injuries can cause chronic pain. And well, chronic pain is a problem in Canada, but it is also a global problem. So if you just type in chronic pain in Google Scholar, you'll probably see studies coming from all over the world. And most of the time, these prevalence rates are about the same across different countries. So we know that chronic pain is a prevalent problem, and it's a global problem. A few years ago, US Centers for Disease Prevention and Control published a report on chronic pain. And they reported that the number of chronic pain cases actually exceed the total number of cancer, diabetes, and cardiovascular diseases combined in the United States. So you can just, try to imagine the number of people who are affected by chronic pain and therefore chronic pain disability. So let's play a guessing game. I will just open up a poll and ask you to guess the prevalence rate of chronic pain in the Canadian working population. So the majority thought that 40% of the employees are affected by chronic pain. Well, according to the numbers from the Canadian Survey on Disability, it is 20%. So that means 1 in every 5 Canadians are suffering from chronic pain. And to put in very simple terms, that means either we or someone we know is actually suffering from chronic pain. So I'll move to the next slide. Okay. So as I told you, our initial attempt in the chronic pain research program was to understand the work experiences of employees with chronic pain. So to do that, we reached out to 13 Canadian employees who are working full-time. And these people self-identified themselves as employees with chronic pain. And we interviewed with them. So these people came from very diverse backgrounds. By diverse, I mean from different roles, from different industries with different education levels. They also had different medical histories. So some of them had arthritis, migraine. We had even one person with trigeminal neuralgia, which I learned that is a very rare disease. And some people even had more than one condition, underlying condition. And without using any theoretical frameworks, we just wanted to, analyze the data using grounded theory approach. And we looked for recurring themes or common patterns in work and chronic pain experience. So these are just very, very brief findings that we learned from this study. So employees told us very different stories about their experiences with working in pain. So we concluded that pain actually is an individualistic experience. I mean, you can expect different experiences from people with different, in different work settings and with different medical histories. But we even had people who did the same job and had the same medical diagnosis, reporting very different experiences. Another finding was that, no surprise, pain was unpredictable. So employees had challenges with preparing for task interruptions because they would never guess when their pain and pain disability will flare up. We also learned that pain communication was not always possible. Again, this is in line with many, studies on invisible disabilities. So some employees did not want to share, disclose their condition due to the factors that you can imagine, such as fear of, stigmatization, job security concerns, or, just not accepting the disability identity. And also, even when they wanted to communicate, explaining how they are feeling was also difficult because colleagues and employers have difficult times understanding the type of challenges that they are going through. And another important observation was that leaders actually played a critical role. So employees who had more positive relationships with their supervisors or managers actually told us less negative stories about how they work. So in our second study with my colleagues Fred Sayan, Nick Turner, Kevin Calloway, and I, we actually prepared a practitioner-oriented paper, and we argued chronic pain as an organizational problem because when mismanaged, chronic pain disability can be very costly for organizations, both directly and indirectly. Just to give some examples, again, when mismanaged, organizations pay for the cost of pain disability through low employee performance, frequent time off from work, or being at work while being sick. Also, organizations pay for the medical bills, the insurance costs, unhealthy culture due to the damaged social relationships associated with mismanaged chronic pain disability. And also, they can pay for legal costs if they cannot manage chronic pain disability well. And then we identified leadership as a critical position in managing chronic pain disability because leaders have both direct and indirect influence over employees' health and well-being. Again, this is something that we know from other types of disabilities as well. And we identified 4 different ways leaders can address chronic pain disability at work. So the first one is the human factors approach. This is also referred as ergonomics approach in some publications. So it basically refers to designing the physical work environment of the employee. So just to give some examples, providing comfortable ergonomic office furniture, or placing tools and machinery to a comfortable level so that employees don't work in awkward positions and don't bend and put too much stress on their bodies, for example, can be considered as human factors interventions. The second approach is the job design approach. Again, this refers to deciding on the core characteristics, common aspects of the jobs. So just to give an example, leaders can design jobs in such a way that employees have autonomy and flexibility. So an employee with chronic pain, with the help of autonomy and flexibility, can actually manage their own pain and work as they need it. The third approach is the psychosocial approach. Again, this encompasses creating psychologically and socially healthy and safe environment. Some examples include creating disability-friendly workplaces, for example, or showing empathy and concern for the employees' health needs. And lastly, we identified legal approach. As you might know, employees with disability are protected by the human rights legislation in Canada. So employees have a right to ask for accommodation at work. And usually leaders are the contact people who provide the accommodation or who coordinate this process between the employee and the organization. And if you read the case law, you'll see lots of cases where leaders were unable to manage this process well, which ended up with high costs, both for the employee and the organization. So poll time, let's do another poll. So this time I'm going to ask you your opinion based on your personal experience. So which of these four approaches do you think would be the most effective? Again, there is no right or wrong answer. I'm just curious about your thoughts. And as you can see, the majority of the participants thought that psychosocial approach would be the most effective. And we have about similar votes on human factors approach and job design approach. That's interesting. Thank you for participation. So we also wanted to approach this problem using the psychosocial approach. Now I'm going to present our last study on this program. Please note that this is still a work in progress, so we have not, we are very much open for feedback. And we are still working on the model, but I'll just present some preliminary findings. So overall, we asked if we can use transformational leadership to prevent work disability due to chronic pain. Let me just give a very high level overview of transformational leadership. We know from the literature that it has the relationship between the transformational leadership model and employee health and well-being is very well established in the literature. So we know that it is an effective tool for other types of disabilities. So we wanted to see if we can apply this model in the chronic pain context as well. So transformational leadership is actually a group of leadership behaviors, and it can be categorized under four broad groups. The first group of behaviors is called individualized consideration. So it refers to attending the personal needs of employees. The second group of behaviors is intellectual stimulation. So basically, with intellectual stimulation, leaders can push the employees to think about their problems from a different perspective. Inspirational motivation refers to inspiring a shared common vision. And lastly, idealized influence is basically walking the talk. So when we apply transformational leadership model to the chronic pain disability, we can, for example, under individualized individual consideration behaviors, leaders can be aware and attend the chronic pain-related needs of their employees. And also, as you know, people with chronic pain disability has different types of challenges at work. So through intellectual stimulation, transformational leaders can encourage them to come up with creative, efficient ways to overcome the barriers at work. With idealized individual influence, transformational leaders can create a sense of meaning and purpose at work, which hopefully give sense and meaning for the employees and keep them in the workforce. And lastly, through inspirational motivation, leaders can inspire and motivate their employees with chronic pain disability and draw a more positive view of the future. So as our theoretical basis, we use the biopsychosocial model of pain. So basically, this is the modern approach to pain. This model says that chronic pain is not only made of physiological components, not just the tissue damage, but it has psychological and social elements as well. And these elements are in an interrelationship with each other. So just to give you an example, how we think and feel about pain can actually affect the tissue damage that we experience, or or our relationships with others through chronic pain. So this is a very, very simple representation of the model that we try to test. So basically, we looked at the relationship between pain and disability, chronic pain disability. Of course, pain doesn't have to translate to disability, but under some conditions, it can. And we asked if we can use transformational leadership to reduce both pain and pain disability. So to answer this question, we collected data from 250 full-time employees with chronic pain. And these employees also worked for an employer and worked under a direct supervisor or a manager. And the majority of our sample was female, almost 2/3 were female. They were 37 years old on average. They worked about 45 hours on average in a week, and they had about 7 years of organizational tenure. And although we asked lots of questions, these are the variables that we are interested in testing this model. So we asked participants to self-rate their pain intensity, the severity of pain. We also asked them how they feel about their pain. So how unpleasant, to what extent their pain is felt unpleasant to them. And together with these scores, both effect and intensity, we form the pain score in our model. We also measured the work disability due to chronic pain using pain interference with work. So we again asked to what extent pain interfered with the employees' regular work. And we also asked participants to rate the transformational leadership behaviors of their direct supervisors. And we used repeated measures design. So basically, except for the demographic questions, we asked the same survey 3 times with 1 month between each time points. And we, we asked the same questions to the same group of people. So as the initial step, we just wanted to see if there was a change in pain and disability and leadership over time across those 3 time points. And with pain, we actually saw a decrease in the experience of pain. And this experience was significant, this decline was significant. So we could say that pain overall just declined over 3 time points. And as you can see, we had a very similar pattern in disability. So again, the level of disability experienced by the participants declined over 3 time points. And this decline was again significant. When we look at the behavior of leadership, the change in leadership over 3 months, we see a very slight increase. However, you may not be able to tell it from the chart, but this increase was so small that we had to conclude that this was non-significant. So we treated leadership as a stable variable, time invariant variable in our model. And we used random intercepts, cross-legged panel model as our modeling as our analytical approach. And basically, this technique partitions out the within and between person variance in the data, in the observed data, and it tests the relationship between within person and between person across time points one by one. So what you see on the screen is the within part of this model. So the circles represent the within person variance in chronic pain and pain disability across 3 time points. So I'll just walk you through the model. So basically, we did not find any significant correlations between pain and pain disability in our first measurement. But we found a significant correlation in between pain and disability in second and third observations. Similarly, pain in time 1 did not affect pain in time 2, but pain in time 2 affected pain in time 3, or at least was positively correlated. Similarly, pain in time 1 was not significantly correlated with disability in time 2, but pain in time 2 was significantly correlated with disability in time 3. So although there are some significant and positive relationships between pain and disability in some time points, because we could not see a similar pattern across measurement points, we might conclude that there's not a significant overall level of change with relationships between pain and disability. And then we added transformational leadership to the model as a time invariant variable. And we looked at its relationship between pain and disability across all 3 time points. So as you can see from the screen, transformational leadership was negatively but significantly related with pain and pain disability in all 3 points. And again, as you can tell from the effect sizes, these are almost about the same across 3 time points. So what does this mean? That means that employees working under transformational leaders overall have lower levels of pain and work disability due to chronic pain. So what does this mean? Is that employees working under, again, transformational leaders overall report lower levels of pain and pain disability, which suggests that leadership, transformational leadership might be an effective strategy preventing chronic pain and chronic pain disability. And in terms of policy implications, although it is too early to talk about the implications, we might suggest organizations to invest in transformational leadership and development of transformational leadership. And one effective way of developing transformational leaders is through training. So we might suggest transformational leadership training or pain-specific transformational leadership training to prevent chronic pain and chronic pain disability at work. So that's about it from me today. I'll just stop now, but these are my online coordinates. And I try to be active on Twitter. So if you would like to reconnect, I'm always happy to reconnect with people who share similar interests. And I guess we have a Q&A session, so I'll just stop now. Thank you so much for attending and listening to me until this point.
Yeah, thank you so much, Duygu. Your research is really, really interesting, and it was pretty great to see you walk through the development of your research on pain and how leadership kind of takes part in that later on. I know I have a few questions for you myself, but for everyone else, if you have questions, just remember you can type them into the chat box, and you can also type them into the Q&A box. I will get to them and make sure to ask Duygu. While we're waiting, one question that I had for you was if in your qualitative study or perhaps in future quantitative research, you're interested in also looking at the role that coworkers might play in the experience of pain and then pain disability.
Yeah, that's a very good question indeed. Then we actually Collegial Support was another team that emerged in our qualitative study, but it was mostly shared as a coping mechanism rather than a source of disability or a cure for disability, basically. But yeah, a few participants, informants share that their colleagues helped them to cope with chronic pain disability. And one vivid example that I remember from that study was that one person said they laugh at his pain disability with his coworkers. And they use, humor just as a coping mechanism. And another person said that their colleagues actually helped them to open the windows, just, with basic tasks, carrying stuff. So yeah, there's definitely, they, at least in our data set, there was definitely mention of collegial support as well.
Thank you. So our next question here is more of a comment. It comes from Laura Lazansky, who said, I really like using leadership as a prevention tool. Prevention is better than picking up the pieces afterwards. It may give employers an incentive if they see how they can be this important part of the process.
Mm-hmm. Yeah, that's a good comment. Yeah, thank you for sharing. Actually, when you read about organizational interventions, they talk about primary, tertiary, secondary, and tertiary interventions. So actually preventing, avoiding chronic pain and chronic pain disability is a type of intervention itself. So yeah, I definitely agree with you.
And our next question comes from Kathy Padkapayeva. Kathy says, thank you, Duygu, for the great presentation. I'm wondering, besides organizations investing in training, what would you recommend to a manager or a supervisor who would like to become a transformational leader?
That's a great question too. So right now we are in the process of developing very, evidence-based recommendations for managers with very practical recommendations. And one of the things that we are planning to share with managers is that talking about pain and even sharing their own experiences with pain, if they have, can actually make a difference. And in terms of becoming more transformational, I think listening to employees with an open mind would be the best strategy that I can think of. But overall, creating a disability-friendly culture. I know this theme comes up in all of these webinars, but it's so important for employees to feel comfortable sharing how they feel and how what they need to be able to continue doing their work.
Thanks. And so our next question comes from Doug Perot, who said, it would be interesting to know the relationship between the duration of living with chronic pain and the worker's disability.
Oh, that's an excellent question. I know that we asked about duration in our data set, but we have not yet the relationship. But yeah, I'm curious now. I want to go back and check the data. Thank you.
Yeah, and just in case, if anyone does have other follow-up questions for Duygu, her email is on the screen. So I'm sure there's lots of other discussions to have here too. And our next question comes from Rhonda Jameson. Rhonda says, was late joining, but what types of transformational leadership training were suggested? Sorry if I missed an important note by joining late. And we also have had a couple other questions too around describing transformational leadership in greater detail. So I'm wondering, Duygu, if maybe you want to talk a bit more about this idea of transformational leadership just more broadly and what it means in this context, and also about training as well.
Sure. I'll just pull up my transformational leadership slide. And Rhonda, don't worry, you did not miss much about the training part. So we know that health-specific leadership can be effective, more effective than general transformational leadership when we are, our goal is to improve health and well-being. But having said that, general transformational leadership training can also be highly effective. At least, well, I mean, we are still testing it on the chronic pain sample, but we know from the mental health disabilities, for example, or any other type of health outcomes, both general transformational leadership or health-specific transformational leadership can be effective. So there's a debate whether we need really, domain-specific leadership training. But according to the available evidence, at least, it might be helpful if this is a serious concern. So in terms of transformational leadership, there's a ton out there, but I'll just, I want to go over our general model. So these 4 groups of behaviors, for example, individualized consideration can, just as an example, asking, learning more about the life of employees outside of their work, knowing about their needs, listening to them, paying attention if they need, anything from their supervisor, but hesitating to share, might be some examples to individualized consideration behaviors. And through intellectual stimulation, transformational leaders, for example, ask if, with individualized considerations, we are assuming that they are aware of the needs of the employees, and they can have conversations on chronic pain with their employees and ask how they can find a solution to their own barriers. So, for example, I mean, on an average work setting, there are usually, rules and policies, and leaders are pushing to implement those policies. But sometimes just, going beyond those rules and encouraging people to find solutions to their problems, and being open to, work with them on those solutions could be really effective. And we can, at least give this approach as an intellectual stimulation behavior or example. With inspirational motivation, talking about a positive future, talking about the inspiring and motivating employees basically for their work can really go a long way. Because when in several studies, we not just we, but other researchers as well, so that with positivity, with having hope and resilience about the future can actually be an effective tool dealing with chronic pain, disability as well, work disability in general. And lastly, idealized influence may have a lower impact compared to other three behaviors. But through idealized influence, transformational leaders become a role model to their employees. So, for example, if a leader also has a chronic pain disability or chronic pain, and if they can show the ways that they are, able to work, or show their own solutions to the challenges that come with disability, I think that might play a big role on employees with disabilities as well. I don't know if that answers your question.
I think that's a great response. And we also had Firat Sayin add a little bit to that as well. He said, to add to Duygu's explanation, transformational leadership training can be effective in creating both psychological and behavioral changes that lead to a higher level of transformational leadership. And he also shared an article that is in the chat if anyone is interested.
Yeah, thank you.
For our next question, it seems that we have a lot of very interested people in your research, which is great because it's a fascinating and important topic. We have questions about whether your slides will be made available, which in terms of this presentation, we will be putting it up on the CRWDP website. There is a webinars page and you can actually see all of the past webinars there. It'll be a little bit of time before this one goes up, but it should be up soon. And I'm sure if you send a message to Duygu, she'll probably be open to sharing that as well. And then another question on this was whether some of this work has been published, and if not, when it will be published.
So thank you for both questions. Yes, if you can just email me, I'm happy to share the slides with you, and I'll just go back to my contact information. About that. So the first study, the qualitative study, is actually in advanced review with the occupational health science. So, and for the other studies, the practitioner-oriented one and there's the longitudinal study are still in the making, but we are hoping to see them published soon as well.
Great. One follow-up question for you too about the link between transformational leadership and chronic pain is, given our current circumstances with COVID-19 and a lot of people now working from home, do you think that the telework environment might in some way influence this relationship, make it stronger, make it weaker, or have it remain the same?
Well, it's hard for me to say whether it makes stronger or harder. But we know that transformational leadership behaviors can be adapted to virtual communication. So actually my PhD supervisor and a co-author in those studies, Kevin Callaway, has a cyber leadership model. And there's other models in the literature as well about virtual leadership. So basically those transformational behaviors, although I should also say that this is not my expertise, but from what I've read, we know I saw that these behaviors can be transferred in the virtual environment as well. So for example, for individualized consideration, just checking with employees on a daily basis, asking how they are doing, how they are coping with the current circumstances, can actually be considered as an individualized consideration behavior, and it can be very well done, over virtual communication.
Great, thank you. So we don't have any more questions remaining. We'll wait a little bit just to see if somebody adds something else into the chat. And while doing so, I'll ask you one potentially final question, which is that you've laid out this really impressive portfolio of research and exploring kind of qualitatively the chronic pain experience, going up to these quantitative assessments of leadership's influence. Where do you see this research going next?
Well, what I would like to incorporate in this model is the mental health component as well. Because if you read research on chronic pain, you see that it goes hand in hand with mental health disorders. So either, if you look at the biopsychosocial model of pain as well, it has a very strong psychological component. So how people feel affect how they experience, physiologically, how they experience pain physiologically, and also how they, experience socially and physiologically affects their, psychological experiences and outcomes as well. So I think without the mental health component, this research might be missing. So we should definitely acknowledge that aspect of chronic pain at some point.
Thank you. And so at this point, are there any kind of closing remarks or final points that you'd like to make?
Thank you very much for the opportunity, and thank you so much for your questions. That was really, that has been a very, very fun experience for me. And as I said, I'm always happy to chat with you outside of this webinar as well. Thank you so much.
Yeah, thank you so much, Duygu. And as well, thank you to Kathy Patkapayeva and Sabrina Imam, who helped make all of this happen. We will have another webinar next month. I believe it is November 30th. You'll also be getting emails about that though. And if you are interested in future webinars, there are lots of ways to learn about them. You can go primarily to the CRWDP website. There's news and events bubbles. There's also a webinar bubble there and a webinar page. So hopefully we'll see you next time. And thanks so much for taking part. Bye for now.
Thank you. Bye.